As a physician who has spent decades caring for patients with joint pain, muscle weakness, knee instability, and progressive loss of mobility, I can tell you with absolute certainty that the decline of the legs and knees is one of the most silent and underestimated causes of suffering in adulthood. Patients often believe that pain, stiffness, and weakness are inevitable with age. They accept difficulty climbing stairs, standing up from a chair, walking for long distances, or maintaining balance as if it were a natural sentence of time. But this belief is not only incomplete, it is dangerous. Your legs and your knees are not just mechanical structures. They are living tissues that depend every day on circulation, nutrition, hormonal balance, oxygenation, and especially on one essential structural protein, collagen. Without sufficient collagen, your joints lose resilience, your cartilage thins, your ligaments weaken, your tendons lose elasticity, and your muscles fatigue faster. This is when weakness appears, followed by instability, inflammation, pain, and eventually degeneration. Collagen is the main structural protein of the body. It forms the framework of cartilage, tendons, ligaments, bones, muscles, and even blood vessels. In the knees, collagen is what allows smooth movement, shock absorption, and joint integrity. In the legs, collagen provides strength to muscles and firmness to connective tissue. Without enough collagen, no supplement, no exercise, no therapy can achieve lasting recovery. What many patients ignore is that collagen production declines progressively with age, stress, chronic inflammation, poor digestion, smoking, lack of sleep, insulin resistance, and nutritional deficiencies. But there is something even more critical that is often overlooked. Your body does not synthesize collagen efficiently without specific micronutrients that come primarily from fruits. And this is not an alternative medicine belief. It is supported by biochemistry and clinical physiology. Certain fruits activate collagen synthesis, protect existing collagen from destruction, improve microcirculation to the knees and legs, reduce inflammation within the joints, and stimulate tissue repair at the cellular level. When these fruits are consumed consistently and correctly, they do not act as a simple dietary addition. They become a true biological support for musculoskeletal recovery. In my clinical practice, I have observed how patients with chronic knee pain, recurrent leg fatigue, joint weakness, and early osteoarthritic changes begin to show meaningful improvement when their nutrition is corrected and specific collagen-supporting fruits are introduced consistently. The change is not immediate, but it is progressive and durable because it works at the root of the problem. Before addressing each of these fruits, it is essential to understand one central medical truth. Collagen itself cannot rebuild your joints if the inflammation that destroys it remains active. Chronic low-grade inflammation is one of the main enemies of your knees and legs. It silently erodes cartilage, impairs blood flow, accelerates muscle breakdown, and disrupts tissue repair. The correct fruits are those that not only provide the building blocks of collagen, but also extinguish the inflammatory environment that destroys it. Now, let us examine how these fruits act in the body and why they are so powerful for leg and knee strength. One of the most clinically valuable fruits for collagen is citrus fruit. Oranges, mandarins, lemons, and related varieties are among the richest natural sources of vitamin C. Vitamin C is not optional for collagen formation. It is absolutely essential. Without vitamin C, the enzymes that bind collagen fibers simply do not function. This leads to weak, fragile connective tissue, delayed healing, easy bruising, and joint instability. In the knees, vitamin C supports the regeneration of cartilage cells, known as chondrocytes. It also strengthens the ligaments that stabilize the joint and supports the integrity of the tendons that allow movement. In the legs, it improves capillary circulation and enhances oxygen delivery to muscle tissue, reducing fatigue and weakness. Beyond collagen synthesis, citrus fruits also reduce oxidative stress inside joints. Oxidative stress accelerates cartilage degradation and perpetuates inflammation. By neutralizing this process, citrus fruits protect your existing joint tissue while enabling new collagen to form. Another fruit with profound medical value for knees and legs is pineapple. This fruit contains bromelain, a group of enzymes with strong anti-inflammatory properties. Bromelain has been used in clinical settings to reduce swelling after injury and surgery. In patients with knee pain, it helps decrease joint inflammation, fluid accumulation, and tissue pressure, all of which interfere with proper movement and collagen repair. Pineapple also provides vitamin C, manganese, and bioactive compounds that support bone metabolism and connective tissue integrity. Manganese plays a role in the formation of cartilage and bone matrix. When manganese levels are insufficient, the knee becomes more vulnerable to degeneration and mechanical damage. Papaya is another fruit that offers exceptional support for joint health. It contains enzymes that improve protein digestion and absorption. This is critical because collagen is a protein, and many people suffer from poor protein assimilation, even if their diet includes enough protein on paper. Without proper digestion, the amino acids needed to build collagen never reach the tissues that need them. Papaya also supplies vitamin C and powerful antioxidants that reduce inflammatory damage within the knee joint and the leg muscles. In many of my patients with chronic knee stiffness upon waking or after prolonged sitting, regular consumption of papaya has been associated with a progressive reduction of that stiffness as inflammation gradually resolves. Berries deserve special attention due to their extraordinary concentration of polyphenols and flavonoids. Blueberries, strawberries, blackberries, and related fruits profoundly inhibit inflammatory signaling inside joints. They protect collagen fibers from enzymatic degradation and strengthen the microvasculature that feeds the joint structures. When microcirculation improves, the delivery of oxygen, nutrients, and amino acids to the knees and leg muscles increases. This directly enhances tissue repair and reduces muscle fatigue. Many patients with burning pain or heaviness in their legs notice improvement in circulation-related symptoms after consistent intake of berries. Avocado plays a different but equally vital role. It provides healthy monounsaturated fats that stabilize cell membranes and reduce inflammatory mediator production. Chronic inflammation cannot resolve efficiently without sufficient healthy fat intake. Moreover, avocado contains vitamin E, which protects collagen fibers from oxidative breakdown. Avocado also supports hormonal balance. This is particularly important in aging individuals, since declining sex hormones are associated with reduced collagen synthesis, muscle loss, and joint degeneration. By supporting a healthier lipid environment and hormonal signaling, avocado indirectly protects both muscle density and joint resilience. Kiwi is one of the most concentrated fruits in terms of vitamin C per serving. It also contains actinidium, an enzyme that supports protein digestion. The combined effect of improved amino acid availability and potent vitamin C delivery makes kiwi a powerful collagen activator. In several clinical studies, vitamin C supplementation has been shown to accelerate collagen repair in damaged tendons and ligaments. Kiwi offers this benefit in a natural form. For patients with recurrent knee injuries, slow recovery, or frequent tendon pain, kiwi can be particularly helpful as part of a daily nutritional strategy. Guava is often underestimated, yet it is one of the richest fruit sources of vitamin C and also provides potassium, magnesium, and carotenoids. Potassium is essential for proper muscle contractions, and magnesium is critical for neuromuscular communication. Deficiencies in these minerals often manifest as leg cramps, weakness, and early fatigue. In the knees, adequate magnesium helps regulate inflammatory responses and reduces abnormal muscle tension that can destabilize the joint. Guava therefore supports both collagen synthesis and the neuromuscular function necessary for joint stability. Cherries deserve specific focus when it comes to knee inflammation and pain. They contain anthocyanins, compounds that inhibit inflammatory enzymes similar to certain pain medications but without the gastrointestinal and cardiovascular risks. In patients with osteoarthritic knee pain or post-exercise inflammation, cherries have been shown to reduce pain perception and inflammatory marker levels. By lowering inflammation, cherries create a biological environment in which collagen repair can proceed without continuous destruction. This is not merely symptomatic relief, it is protective at the tissue level. While these fruits each act through distinct biochemical pathways, their therapeutic value is amplified when they are consumed regularly in combination as part of a consistent nutritional pattern. No single fruit works as a miracle by itself. The body functions through synergy. However, fruit consumption alone is not enough if other destructive factors are not addressed. From a medical standpoint, there are several behaviors that silently destroy collagen and weaken the knees and legs, regardless of how many beneficial fruits a person eats. Excess refined sugar accelerates collagen glycation, making collagen fibers stiff, brittle, and structurally defective. This leads to weaker cartilage and more fragile ligaments. Chronic inflammation, driven by poor sleep, psychological stress, and sedentary behavior, continuously erodes joint tissue. Smoking directly damages collagen synthesis and microcirculation. Dehydration reduces the shock-absorbing capacity of cartilage. A lack of adequate protein intake deprives the body of the raw materials needed to build collagen even when vitamin levels are sufficient. For patients truly committed to strengthening their knees and legs, these factors must be corrected alongside proper fruit intake. Another overlooked aspect is mechanical loading. Collagen fibers require proper mechanical stimulation to align and strengthen. Gentle weight-bearing activity, controlled resistance exercise, and consistent walking stimulate collagen remodeling in both joints and muscles. Without mechanical stimulus, collagen remains weak even when nutritional conditions are optimal. It is important to clarify that collagen supplements alone are not a solution. Collagen consumed orally must be digested into amino acids before it can be used. Without sufficient vitamin C, zinc, copper, and overall metabolic health, much of that collagen cannot be efficiently rebuilt in joint tissue. Fruits provide the essential cofactors that make collagen supplementation, if used, physiologically effective. In patients with established knee degeneration or advanced muscle weakness, improvement requires sustained intervention over months. Collagen is not rebuilt overnight. Tendons and cartilage regenerate slowly. However, when inflammation is controlled, mineral balance corrected, circulation improved, and collagen synthesis activated, meaningful functional improvement is possible even in later decades of life. I have witnessed patients who arrived with fear of walking, dependence on pain medications, and constant instability, and who gradually regained confidence, mobility, and strength through a structured approach that included nutritional therapy based on these principles. Their knees became more stable. Their legs recovered endurance. Pain diminished not because it was suppressed, but because the tissue environment itself improved. From a physiological perspective, the goal is to transition your body from a state of continuous tissue breakdown to a state of daily tissue repairs. Fruits rich in vitamin C, antioxidants, enzymes, and minerals are powerful regulators of this transition. Strengthening your legs and knees is not simply a matter of avoiding pain. It is fundamentally about protecting your independence, your balance, your ability to move without fear, and ultimately your quality of life. Once knee instability and leg weakness advance too far, the risk of falls, fractures, hospitalizations, and loss of autonomy rises dramatically. Prevention and recovery begin long before severe pain appears. They begin when you support collagen daily, reduce inflammation consistently, and nourish the tissues that carry you through life. As a doctor, my responsibility is not only to treat disease, but to teach how to preserve function. Your knees and legs were designed to carry you with strength for many decades. With proper biological support, they can continue to do so far longer than most people believe. If you correct the internal environment that fuels degeneration and actively support the structures that sustain movement, weakness is not an inevitable destiny. It is a reversible condition rooted in biology, not fate. The daily decisions you make at the cellular level determine the future of your mobility, and those decisions begin with what you place on your plate.